Hi, good afternoon, everybody. I hope everyone can hear me okay. If you're having any issues at all hearing us, please let us know. You can either type to us in the chat, or you can unmute yourself and ask any questions or talk to us as much as you'd like. We're happy to have so many people today. I think we have a great topic. I'm Dr. Horn with infectious disease and MD stewardship.
I'm Dr. V with infectious disease. Can somebody type in the Zoom chat and let us know if you could hear us? Or just a wave? Oh, perfect. Thank you. So we have a really good topic to talk about today, the role of nursing staff as a key member of the antimicrobial stewardship team. So please feel free to ask us any questions during the webinar, or after we're done, we could have a good discussion.
Yes, and these webinars have been going really well. We've had a lot of participants, and we've had really good questions and a lot of good feedback and about topics to do in the future. But if there's anything that we haven't covered or you'd like us to cover again, anything that you'd like to go over at all, then most likely there are other sites and other hospitals that want to go over the same topics, and we're more than happy to cover anything that you'd like us to talk about. We've, I think, covered a lot of topics, but we'd like to at some point circle back and go over some of the topics again, because they're such large topics, and we try to cover them in about 20 to 25 minutes with these webinars. And we've had a lot of great progress, but we'd love to cover topics that everyone wants to hear about.
Send us emails with any topics, and we're more than happy to. And this topic, actually, somebody brought this up, so that's how we decided to do this topic and this month. So please keep on coming, and we could ready to start?
Yeah, I think we're ready to start.
Perfect.
So
I was going to talk to you guys about this paper that was recently published, Growing Recognition of the Need to Partner with Nurses to Provide Effective Antibiotic Stewardship. So this study explored 5 different attitudes of nurses and infection preventionists towards 5 nurse-driven antibiotic stewardship practices. How they did this study, it was a survey questionnaire they sent to multiple different institutions and asked for feedback from our nursing staff to see what are the roles that our nursing staff feel comfortable playing in the area of antimicrobial stewardship. So the questionnaire addressed, and then they got about, I think about 81 to 100 respondents back with different nursing departments with their input. And one of the first questions was questioning the need for urine culture. And we know in antimicrobial stewardship, every day, lots of patients are urine cultures obtained unnecessarily. And our nursing staff are our bedside first contact with our patients. And they could play a huge role in reducing the urine culture that we obtain. For example, if an elderly patient comes into the hospital and they're coming from a nursing home and they have mental status change, they have dementia, automatically a urine culture is ordered. And it might just be asymptomatic bacteriuria, but then that elderly patient gets unnecessary antibiotic. So even before we get the antibiotic, our nursing staff can help us to determine, do we even need this urine culture? So I think that was one of the ideas behind the first question. Ensuring proper culturing techniques. As physicians, providers, we order blood cultures, but our nursing staff are at the bedside actually helping getting those cultures, so they could help us with that. Recording allergies. So a lot of patients get flagged in our system as patients have allergies to penicillin, and then the patient cannot have any antibiotics, penicillins, cephalosporin, carbapenems, because all of them are related at beta-lactams. So again, our nursing staff can really help at bedside to get a real accurate allergy history, because most of the time patients might just say, oh, I'm allergic because I had nausea, oh, I had some stomach upset, but it's really not true allergy. Allergies, when we worry about, like, I couldn't breathe or my tongue swelled up, So I think we could get that differentiation and then not give patients unnecessary powerful antibiotics. Another component is encouraging prompt transition from IV to PO. A lot of time providers can, they'll order IV levofloxacin, for example, because the patient, you know, they were worried about mental status change and they couldn't take anything oral. And then the patient sits on IV antibiotics for like 5 days. Meanwhile, bedside nursing staff are the one that know, oh, patient is eating now. They could take oral antibiotics. So that's a very crucial, important. And then initiating antibiotic timeouts. One of the Joint Commission CMS requirements, and they are encouraging us to have timeouts for patients when they are on antibiotics for so long. And, you know, during rounds, bedside rounds, you know, our nursing staff can play a huge role, you know, reminding the provider, you know, this patient has been on vancomycin, Zosyn, Levo for like 4 days now. So that timeout and making sure that every team member knows how long the patient has been in getting antibiotics is another crucial part. So they looked at all 5 questions and they got feedback. And the feedback they got was nurse-driven antibiotic stewardship was perceived as an extension of the nurse's role as a patient advocate. And all our nursing staff, you know, they always advocate for our patients. So this is a great, they see this as their role. And 3 of the areas that they really, in this paper, they really wanted to help was questioning the necessity of urine culture, ensuring proper techniques of cultures we get so we don't get a lot of contaminants like coagulase negative staph and the patient gets unnecessary vancomycin. So eliminating that and getting good cultures and encouraging the team to let the patient can have oral antibiotics. So less IV antibiotic, patient gets to go home sooner. So, and also the infection prevention has welcomed the opportunity to assist in providing the nurse stewardship education model as well. And nurses appeared to be enthusiastic about participating in antibiotic stewardship. So this paper was really good. It kind of showed how our nursing staff do want to be part of our antimicrobial stewardship team. And me and Dr. Horn totally believe our nursing staff would be part of our antimicrobial stewardship team to get a better outcome for our patients.
Yeah, I mean, I think this was a great study to do to see, you know, what are their perceptions, how do people feel about it. So I think more studies like this. I mean, I think this showed it really.
Yeah.
Yeah, I think, yeah. And then this was another study. This was this is titled "The Critical Role of Staff Nurse in Antimicrobial Stewardship: Unrecognized but Already There." So, I mean, the goal of antimicrobial stewardship is to give antibiotics correctly, and really anything that that has that goal of giving antibiotics correctly and can improve antibiotic use and outcomes. It seems, I mean, obvious that nurses would have a huge role in this, and it's kind of why we wanted to do this this webinar to discuss it. I think that this article is saying nurses are essential participants in stewardship and have been unrecognized and underutilized. And it says, although the role of staff nurses has not formally been recognized by the ASP is Antimicrobial Stewardship Program guidelines, they have always performed numerous functions that are integral to successful stewardship. So I think it's really about not only showing the role that's already there, but getting credit for what's already being done. Mm-hmm. Nurses are antibiotic first responders, central communicators, coordinators of care, as well as 24-hour monitors of patient status, safety, and response to antibiotic therapy. So I think not only are they already performing the duties, but they should be recognized for it and encouraged and given you know, more information about the important role that they're playing. So this is a large chart, and it might be kind of small on your screens, but we're going to send out this this PowerPoint to everybody as well, because really I'd like this with some of the large charts more to be something that you can refer to and look back on, or to see where to get more information. So this is a large chart, but it shows what's happening with the patient and then who's doing the role. And this is, it's blown up, this is to show that I wanted to blow up the nursing part of it and show that the specific duties that the nurse is doing. And there's another, we'll get into this a little bit more in a few slides, but I wanted to show that there are multiple studies showing the same thing, that nurses are already performing a lot of the important duties, which should be recognized. So in this one, it has patient admission. The nurse is taking the cultures, timely antibiotic initiation, and these are things that antimicrobial stewardship programs they're looking to make sure antibiotics are given quickly, but then they don't really take into account the nurse is the one that's actually performing the role and getting it done. So
I really like this chart. If you go back, John,
yeah,
it shows, like, if you look at nursing, nursing, and also if you look at the provider, nurses actually have more responsibility than the provider or the inpatient physician. Mm-hmm. So all these to be met, we need to encourage our nursing staff to be involved in this. It nicely illustrates that.
Yes, and while the other roles are the ones that might be getting credit for it, the nurse is the one that's actually doing it. So we'll get into this a little bit more in the nursing white paper that came out. But this is, I think, very well demonstrated here. Yeah, and this is the white paper.
So CDC and the American Nurses Association worked together, and this was effective and published in 2017, defining the antibiotic stewardship team. Recommendation from American Nurses Association and CDC and Prevention Work Group on the role of registered nurse in hospital antibiotic stewardship practices. So this paper was recently published, and it talks about official roles that we need to do. The purpose of the work group is to explore how nurses can become more engaged and take leadership role to enhance our nation's antibiotic stewardship effort. So part 1 of the white paper is current state of antibiotic stewardship programs. Part 2, barriers to full nurse participation in antibiotic stewardship program, gaps in nursing knowledge and education about stewardship. And part 3, explore the opportunity for nurses to add their expertise to stewardship effort and offer a recommendation for future nursing education. And if you go to the here, so a while back, I think it was in 2012, when our initial antibiotic stewardship guidelines were published, they defined what a core member should be. And also CMS and Joint Commission also recommends what a core member for antibiotic stewardship multidisciplinary team. So initially they said infectious disease physician if you have, dedicated clinical pharmacy staff if they're preferably ID trained, infectious disease trained, clinical microbiologists, and infection control personnel. But what's missing here is our key member is our nursing staff. So this white paper is going to address how we change this team. Some of the, for antimicrobial stewardship as of January 2017, we need to have 7 core elements for each hospital, nursing homes, long-term care, critical access hospitals to say that they have a proper antimicrobial stewardship component. The first component is leadership commitment, having a dedicated, necessary human, financial, information technology resources. So the hospital making commitment to have stewardship team. Accountability, having a single leader for the program outcomes or a physician leader. Drug expertise, appointing a single pharmacy leader responsible working, improving antibiotic use. Action, implementing at least one recommended action such as systemic evaluation ongoing. So for example, having a 48-hour timeout to see, if a patient is on triple antibiotic, are we reducing that now? Are we getting rid of the vancomycins once we know there's no Staph aureus MR, say?
Right, or prospective audit and feedback, essentially reviewing the patients that are on antibiotics in real time and seeing if we can make any recommendations. Yeah.
And tracking and monitoring antibiotic prescription and resistant patterns. So looking at an antibiogram to make sure our E. coli is not getting worse. Oh, making sure our providers are not prescribing too much carbapenem, and kind of tracking and making sure everybody knows that information. Reporting regular reporting information on antibiotic use to all the healthcare staff, so they are aware how are we using antibiotic at each hospital. And also education, to make sure we provide education to all our healthcare staff about different topics like this one we're doing right now.
Right, and it'd be important to show that the Joint Commission standard also includes nurses, and includes nurses, it has them here for reporting, but the reporting should be, in this instance, it's reporting back to the nurses and the doctors, all of the providers about how it's going, how we're doing, and then working to improve if needed. But it's really important to show that nurses are included, and sometimes I think the leadership doesn't always understand that, or understand the importance of it, that it's included, that you need to show this to the Joint Commission that everyone's playing a role. And so the white paper kind of goes through and it looks at the current state and then makes recommendations about how to involve nurses more in the future and really how it should be changed. And so here, for example, it has the functions. So it'll have the stewardship or activity here on the left, the appropriate triage and isolation, the CDC core element, core stewardship element, who is doing it right now, so the infection preventionist. But then it has the unrecognized nurse role in stewardship. The nurse initially assesses the source of the infection, identifies the appropriate precautions. Consultations may come subsequently from the infection preventionist. But it's important to show what's already being done so that can be recognized.
Yeah, an example is like when a patient is being transferred from another hospital to your hospital and they have C. diff, the first person that gets that information is our bedside nursing staff when they get the transfer information. So they're the one who are putting the patient in isolation first, and then only our infection preventionist personnel gets to know the information. So it's and so that's how, in the line of events, our nursing staff is the first to know the information.
And then accurate antibiotic allergy history. So it's important to take an allergy history, but then here in how it is right now, the pharmacist is here, the ASP model. The role is responsible, the pharmacist is responsible for taking the allergy history, but the nurse takes the allergy history, performs medication reconciliation, and records this in the medical record. So there are kind of a lot of these. We'll go to the next slide. There are kind of a lot of these where it's shown, it's kind of remarkable that this has to be highlighted so much because it seems so obvious when you look at it. So, I mean, once the paper came out, it's like, oh, this is clearly something that,
In my mind, every single time it's a role responsible in current ASP model, we need to have our nursing staff in there for every single one of these boxes,
Right.
Going forward.
Right. I mean, antibiotics, antibiotic use and resistance is essentially a national emergency.
Yeah.
I think that the antibiotics, as they cease to work, and they're calling it kind of a post-antibiotic world, where antibiotics won't work anymore. Really, I mean, the correct use of antibiotics should be at the forefront.
And data shows, like, for example, even C. diff, like we have more than 15,000 deaths per year due to C. diff, and more than 500,000 patients are infected with C. diff. So, the less antibiotics we give and more people we get to work on this, I think less patients will get ill.
So the next role is early and appropriate cultures, and that's also important for sepsis, septic shock patients. So the hospitalist orders it, the microbiologist interprets it, but then the nurse is the one that's actually obtains the cultures before starting the antibiotics, sends the cultures to the microbiology lab, monitors the culture results, and reports to the physician and also to the family. So timely antibiotic initiation. So the hospitalist orders it, the ID doctor helps along the ordering of the antibiotics and which antibiotics to use. The preventionist and the pharmacist also play a role, but the nurse receives the orders, reviews the dose, the time for accuracy, checks for allergy administration, and records the antibiotics and actually gives the antibiotics.
Yeah.
So,
and also with our sepsis guidelines and having to give antibiotic within the first hour, our nursing staff are the key to making sure.
And then we don't need to go through all of it. I wanted to kind of include a lot of it, just, and again, we'll send out the PowerPoint and you can have it for a reference, and also to see, to go through it more in detail. But progress reporting, antibiotic adjustments based on microbiology reports, the dosing, culture and susceptibility reporting, de-escalation. And then here, clinical progress and patient safety monitoring, adverse events. The nurse monitors and reports to the physician, the pharmacist, any adverse events, including diarrhea. The orders, antibiotic resistance, superinfection and resistant infections. Here, transition from IV to PO, length of stay, patient education and medication reconciliation, outpatient visiting nurse association, let's see, long-term care facility transition management, readmission to the hospital. These are all roles that, when it's looked at, it's very clear that the nurse has a very large role, the one performing. Yeah. And so this highlights the need to include nurses within the antimicrobial stewardship efforts.
I really like this graph, how it shows that, patient family, then we have our nursing staff, and then it's the rest of the team, the ID physician, the hospitalist, microlab, the pharmacy, the admin. So it's our nursing staff and our patients are the key, and everybody else is working around them. And I really like this diagram, how it illustrates.
Yes, I think, the bedside nurse is right there with the patient the whole time. So, and spends the most time with the patient. Yep. I think this is a great way to illustrate it.
Mm-hmm. And I think going forward, each one of our hospitals in our antimicrobial stewardship team, we need to have our nursing staff represented as well.
Yes, yes, I think, at the antimicrobial stewardship meetings, I think committee meetings.
It's important for every single hospital, I think, to kind of reflect and making sure that we have our nursing staff represented in those meetings to make sure.
And here, this is also from the white paper, how can we engage nurses more and encourage them to participate in antimicrobial stewardship programs? And the program had at the national level, but I thought it was most important to include at the hospital level. Provide antimicrobial stewardship program education for bedside nurses, and this could be provided by nurses already engaged in stewardship activities, ID physicians, pharmacists, include nurses in stewardship rounds. So when we discuss antibiotic use and all the different parts of it, inclusion, I think that's a wonderful idea. Participate in journal clubs, develop specific content messages for nurses as part of hospital efforts to raise awareness about antibiotic use and resistance. So when antibiotic use and resistance messages go out, I think that's, like I said, it seems obvious looking at it, but encourage nurse stewardship champions at the unit level. So it's important to highlight what is already being done, to understand what's being done and the importance of it, and how important it is in stewardship to really have a good stewardship program at the hospital.
I really like the fact they talk about unit level, because having one nursing staff or two nursing staff come to the stewardship meeting is great, but to disseminate that information to every single unit, like PICU, NICU, ICU, PCU, surgery floor, it's important to have champions in each floor as well, because then they could disseminate more of that information. So champions plus team members are important.
And here, what can we do to engage nursing leaders in stewardship efforts? So highlight the fact that nursing involvement is required by the Joint Commission. So this is something that it's a requirement by the Joint Commission. And so this is something that should be included and focused on, and make sure that that it's happening. Make hospital leadership aware that the CMS has proposed making ASP a condition of participation for all hospitals. Emphasize stewardship as a key component for patient safety. Highlight the benefit of good antibiotic stewardship on nursing workload. For example, better IV to PO conversion or reduce time spent on medication administration. So using antibiotics correctly, the goal is for good patient outcomes, but it also it saves money. It saves the workload will be reduced. It has so many good outcomes.
And patient too, like patient gets to go home early and not spend, more time if they could go from IV to oral when the provider doesn't realize it. But if we could remind them that during rounds, that's a big deal for the patient to go home early.
Right. If there are antibiotics that are their bioavailability is very good, they get into the body just as well as IV, then the patient will be able to go home faster. It's better for the patient. It's better for the hospital. It's better better for antibiotic resistance. Yeah. And then knowledge gaps, which present challenges to nurses' involvement in stewardship efforts. First, nurses may be unfamiliar with the concept of antimicrobial stewardship. And I like the words antimicrobial stewardship, but sometimes they can kind of throw people. The first time I heard it, I thought, that's a pretty big word. And then I find out the meaning of it. And sometimes the definitions are to maximize the good parts of antibiotics and minimize all the downsides. And when really it's just using antibiotics correctly. So it's the concept. Everybody knows of the concept, but not everyone's heard the words antimicrobial stewardship. Second, nurses may be insecure about their knowledge of microbiology and antibiotic use. Third, nurses may believe that antimicrobial stewardship is not their function because they do not perceive themselves as antibiotic prescribers. And as we've shown, they have an integral role. It's just realizing it and realizing what they've already been doing. There's a lack of metrics that quantify nurses' impact on stewardship efforts. So
more studies needs to be done and highlight all the important work that our nursing staff are doing already.
Yes, stewardship is pretty new concept, and so it's still, I think, in its infancy. It'll continue to get larger. So here's the summary slide. Nursing is already incorporated in hospital administration, case management, quality management, informatics. Integrating nurses into stewardship brings an additional perspective and fosters acceptance of antimicrobial stewardship principles. So nursing experience can not only help improve clinical outcomes, but can also identify novel patient care improvements that can lead to other healthcare disciplines.
All right.
Somebody is unmuted, so we could hear you guys. Can you make sure?
Oh, yes. So that concludes the talk, but we're happy to answer any questions that you have, or feel free to unmute yourself and ask any questions, or go ahead and type in any questions that you have so we can, we'd be happy to discuss them.
I think this is a really great topic, and any question is welcomed.
Yes, I think that at the last Infectious Disease Society of America meeting, that I think was one of the best presentations I went to. There was a stewardship nurse there that had been advocating for nurses in stewardship, and really, I hadn't seen anything like that before.
Yeah.
But once you see a presentation like that, it's like it makes total sense. It's kind of like, why haven't we been doing this all along?
I think it's important though to go back and evaluate at each one of our hospitals and make sure that we have nursing representation at each one of the antimicrobial stewardship meeting, because this is clearly illustrating, and we need our nursing voice in each of our meetings as well. Any questions? Feel free to type in.
Well, we will, we recorded this talk, and we're going to put it up on the internet, and we'll send out a link to it. So feel free to share it with whoever you like. And we're happy to talk about anything stewardship. I think this was a great topic, and I think this is the kind of thing that needs to be kind of discussed more in all of our stewardship meetings.
And please let us know if you guys would like us to cover a different topic next month. Happy to do it.
All right. Well, thank you very much, everybody. And that concludes our talk. Please, feel free to send us an email or give us a call. And we're happy to hear from everybody. Thank you again. Have a good day.